morning, everybody. Thank you for joining us here today on this lovely spring break week. For those of you who are off, we're glad that you're joining us here at Southeastern Louisiana University. We're off as well, so we just want to thank our graduate students for presenting with us on their break. And just a quick introduction, my name is Reshelle Marino. I'm Associate Professor at Southeastern Louisiana University in the Master's Program in Counseling. And I have my colleague here with us, Dr. Laura, if you want to introduce yourself and our two graduate students.
Sure. I'm Dr. Laura Fazio-Griffith, and I am an Associate Professor in Counseling at Southeastern Louisiana University.
My name is Dalina Dalmans, and I'm a graduate student at Southeastern.
And I'm Bailey Zachary, and I'm also a graduate student at Southeastern.
Great, thank you all. So I was teaching a group counseling class a couple of semesters ago, and Bailey was one of the students in the class, and part of the group assignment is to come up with a group proposal. And Bailey had a strong interest in providing counseling services, in particular for first responders. And Bailey's mom is a police officer, and she has had a lifetime of experience seeing what her mom has gone through. And she'll talk a little bit about that in a second as we progress with the presentation. But we really found it quite interesting how much not only everyone needed support and interventions after the past year with the pandemic, but in particular first responders. Also, my love, it's very dear to my heart, this topic, because I'm also married to a first responder. He's a fireman and has been since 2005. So speaking with him and just finding out the gaps in the departments and what is really not there in respect specifically to mental health services, we found this was a really important topic to discuss with you all today. So we tied in the use of expressive arts post-COVID or during COVID and with first responders. So I'll turn it over right to Bailey to talk about that.
Hi, so of course we're talking about first responders today, and our next slide should have, so of course, when we talk about first responders, that's going to refer to EMTs, firefighters, and police officers, because those are the people designated and trained to respond immediately to the scene of an accident or emergency to provide assistance. And I'm sure, as we all know, they are essential to the community, but of course, over time, that job equals an increase of risk of trauma and being exposed to that over their careers. So understanding the experience, so here we have a list of critical incidents, and this was done from a study in 2015 on small to mid-sized law enforcement agencies. So that would mean they are looking at departments that are serving populations around 100,000 or less, and that's actually about half of the population of the country would be this small to mid-sized departments. Now, as you can see, I included this to give a pretty clear, some specific examples of what that exposure to trauma can look like for these first responders. And while this study was done on law enforcement, you can clearly see some of these. You would have multiple agencies responding to these incidences. For example, a badly beaten adult, let's say that's a domestic abuse situation. So police would respond. Of course, there's criminal activity, they need to make an arrest, but you may also have EMTs on scene to be directly treating that person who's experienced that abuse as well. Again, a car accident, you may see police on scene, but of course fire could show up as well to help also with medical training as well, because sometimes EMT and fire, there can be medical training in both of those departments. So a lot of the research can sometimes be combined in that aspect. So I included this, of course, because like I said, it creates a specific picture of some of that trauma they could directly or indirectly be experiencing. So as we go through the presentation, you have an idea of what are those experiences that might come up for you in session working with first responders. Okay. So of course, going from that chart to here, understand the experience of, this is frequent exposure to death, injury, pain, loss, as well as direct exposure to their personal safety, potentially getting shot at or getting injured on the job, running into a burning building. Frequent shifts, longer shift hours, those shifts can change, thus poor sleep and physical hardships, and also other negative experiences that could be brought home. So not only are they dealing with, working all day, these long shifts, but that's going to have a direct impact on their family life, their social life, and those relationships they hold close to them. So from that study, we see that they uncovered that those officers would experience over 188 critical incidents over their career. So that can mean between a career average of 20 to 30 years. And well, that's a lot. So we can see and imagine also that they get no mental health interventions during that career, and thinking about the impact of witnessing 188 critical incidences, exposures to trauma over that lifetime. Because of this, there's a job first state of mind that's created that can include detachment, quick assessment, self-directed immediate response that is so difficult to turn off. Just because they get off of shift does not mean that that first responder mindset is off as well. And that creates a mindset of vigilance. And kind of a mild example I have of that from my own life is we knew going to a restaurant, there was a certain seat at the table you did not sit at. If it was the chair facing the door of the restaurant, that was my mom's seat. Didn't mean that she wasn't present with us, didn't mean that she wasn't engaged in the conversation. There was just a part of her mind that came from training, learned experiences that she had to be aware and ready for whatever might walk through that door. So again, kind of a mild experience, but something that growing up I saw as, well, she was a first responder, that's where that came from. And because of this, that mindset's always on, all these learned experiences and behaviors that they have, we're going to see elevated rates of depression, substance abuse to cope with these things, PTSD and stress, and suicide and suicide ideation that are going to be at higher levels than the general population. Now, also, too, you might have seen in that chart, in 2015, one of those critical incidents that was on there was exposure to disease. So that was in 2015 while we weren't in the middle of a pandemic. And now here we are in COVID, where so everyone is going to work and scared of what they might be bringing home and affecting their loved ones or being isolated from their loved ones. But first responders are carrying that exposure to trauma already. Now let's add another potential risk to that as well.
Just like Bailey was saying, like the symptoms and diagnoses such as like trauma, loss, depression, lack of sleep, burnout, substance use, PTSD, and suicidal ideation could be part of first responders' daily lives. So why would we utilize expressive arts with first responders? Expressive arts can promote self-confidence in first responders while sharing their experience and reactions through example drawing, journaling, or making a meditative painting, rather than by just using slowly talk therapy. First responders experience trauma when talking about it, and this can be very difficult for some clients. Therefore, when we allow them to start a conversation with expressive art activities, it can be very beneficial to the therapeutic process. Through facilitating expressive arts, first responders can be confident expressing themselves, and it can give them like a sense of identity and worth. Through expressive arts, it can not only help facilitate and deliver traumatic information, but it also can focus on clients with a holistic approach. It does not only help the client express themselves, but it also helps the therapist to kind of understand and open up more doorways for clients who have experienced trauma. We hear studies talk about expressive arts leading to establishing connection to others, but most importantly, it leads to a client who has trauma that can help them reconnect to themselves. An example of a first responder's trauma could be a firefighter rescuing 4 people from a burning house and only 3 people survive. So not only is the environment that the firefighter is in already super traumatic in itself, but also not being able to help and save everyone. This kind of goes back to like the first things, that the symptoms of like depression, PTSD, and that could lead to like substance use or maybe even suicidal ideation. And this could be very hard for a first responder to process. And through using expressive art interventions, it could enable a first responder to talk about their feelings and kind of like process them and feel more empowered as they like go and share their feelings throughout those sessions. Sometimes people will get frightened to tell someone that who has happened to have like a severe trauma. And when we talk about trauma, we often also relive it. And with first responders, when we use expressive arts, like even going back to my example with the firefighter, it could be less of an anxious approach, and it can help open up to some of those unconscious emotions, and it can help kind of like connect with themselves again by acknowledging what they were feeling back in that moment. Right, you can go to the next slide. So there was some more research done that I have listed on the reference page at the end. It kind of showed that expressive art helped promote a therapeutic relationship, and it helped guide the process of recovery clients who experience trauma. Even from personal example, when I use expressive art with people who had undergone severe trauma, they have communicated to me how using expressive art was very helpful in establishing and building the alliance, or setting kind of like the frame just for a therapeutic relationship. Like I was able to notice that when, you know, the client was getting more comfortable talking about certain things, where it was having kind of like more of an understanding of what had happened to them, it gave them also more insight into their emotion and how it impacted them in certain ways. And this include like lack of sleep, feeling more anxious in an environment, hearing certain sounds, just being more prone to like senses, and just also interacting with others. So with that being said, expressive arts can also help foster connections of clients with the outside world again. It's like hope is restored back in the client, and hope potentially could lead to a safer environment for those clients as a kind of reconnect to relationship with others. Expressive arts offers clients to make choices in how they would like to express themselves. So for some, this might be music. For others, it could be mandala, sand tray, or even Play-Doh. So by allowing the space for clients basically to choose, the client is giving a choice and control over how they want to address their trauma. And I think that can be very beneficial with first responders. All right, you can skip the next slide. Expressive arts can help reframe ideas, shift perspective, and externalize emotions, and kind of like deliver overall a better understanding of the event. Through facilitating expressive arts, first responders may experience new ways to explore the trauma and rebuild a sense of safeness and secure attachment with that. Just different than just talk therapy. Expressive arts is ageless. We tend to use it really a lot with like children. However, I would like to stress that arts in adults who especially suffered from trauma was found to inspire them, and with the experienced trauma, it kind of gave them hope by using expressive arts to kind of like go back and recollect those memories and build new ways and how to cope with them. So with that being said, it's kind of like also on the therapist providing the space for the client. It can help raise bodily awareness as well as advocacy in clients who really struggle on verbally expressing their emotions. The therapist could then be seen basically as a witness, and it could help really help that process of therapeutic alliance through expressive arts. Next slide.
Okay, so I'm going to talk about some specific expressive arts techniques that folks can use, that clinicians can use with first responders who have experienced some trauma. And I think, you know, it's important to note that with the pandemic and COVID-19 and all of the effects that we're seeing with that with first responders, you know, that just really increases the traumatic events that they've been exposed to. So it's not just them doing their normal job like fighting fires or having to go into, you know, these adverse situations, but also with the pandemic, it's just added to the stress and the trauma that they've experienced. So what we've done is we've just targeted some interventions that are really effective with folks who have experienced trauma, specifically first responders. And of course, there's a lot of them out there, and we don't have, you know, time in an hour to go through all of them, but I hope that these will, you know, be helpful, you know, to you. So one of the things that I want to say is that when you are going to introduce an expressive art technique or a play therapy intervention with adults, I mean, as Delina said, you know, usually when we think of expressive arts and play therapy, we think of kids and we think of adolescents. We don't necessarily think of integrating the these techniques with adults. So one of the things that is really important is that you have a solid relationship with the client. You know, you wouldn't necessarily want to introduce an expressive art technique or a play therapy technique during your initial session or maybe during the second or third session. You really want to make sure that you have a solid relationship and that they feel safe enough that they'll want to participate in an expressive art activity or a play therapy intervention. So one of the things that I will do with adults, and as Delina talked about, it's really a lot about choice, giving them control and giving them the power back. So I will introduce expressive arts just as a general concept, and I will let the client know, you know, sometimes we have different modes of interventions as opposed to just traditional talk therapy. And one of the things that I like to try are some art, you know, interventions and maybe some play interventions. You know, would you be willing to try some of those? And so I asked the client, you know, and it's the client's choice as to whether they want to, you know, try and engage with some expressive art techniques or if they don't. And if they say no right off the bat, that doesn't mean that down the road they might not be willing to do that. They just might not feel safe enough or secure enough in the relationship to do some expressive arts. So the first one that I'm going to introduce is called masking or sculpting. And I think this is very beneficial for first responders because I think, as Bailey mentioned, you know, first responders carry a certain vigilance and certain characteristics with them when they are off duty per se. And so I think working with first responders to have them understand that we all wear masks, you know, we all do that. We all present different personas to different people, different places, how we interact with different people. So working with first responders to allowing them to look at the mask that they wear. What mask do you wear when you are off duty, maybe with your family, and how does some of those characteristics or how does that vigilance, you know, come into play when you're off duty or when you're on duty? Is it completely different? You know, what mask is it that you wear? And it really gives them an opportunity to discuss emotions, like real emotions, and what it's like for them maybe to have that vigilance all the time or to carry those characteristics with them all the time, you know, 24/7. And when can they remove the mask? When is that appropriate, you know, to remove the mask and really to have some discussions about those real emotions that they are feeling. And so this is an activity that can be done with paper plates. You know, you can take paper plates and have them, you know, create a mask on the paper plate. You can I've used popsicle sticks and have them cut out a mask and, you know, glue it on the popsicle stick. And you can just do it any way you want. They can draw it, you know, if they're not really in the creativity about actually creating it on a paper plate, they can draw it if they want. I've also clients who, you know, really aren't comfortable with drawing. They've done symbols. You know, what would symbolize the mask that you wear? And we've done it that way. So there's a couple of different ways that you can do it. You can also use Play-Doh or clay, you know, if they're comfortable with that medium. Okay, eco mapping is the second one. And it's really important for first responders to feel like they have a support system. I think that's important for any client who's experienced any kind of traumatic event. And so this allows the client to see connections with others and to look at what is my support system? What does my system look like out there? And then throughout the therapeutic process, you can work with the client to track changes and support in the network. So when the client comes in, this is very beneficial to do maybe in the beginning of your time with the client, then doing it toward the middle of the therapeutic process, and then at the end to see how that support system might have grown. Has it changed? Are there people who are no longer in the support system, you know, that they don't need in that support system anymore? So it really allows the client to have some control to determine who is in my support system, who do I need, what supports do they provide? And it also helps with their self-worth and their self-concept, especially if they have experienced trauma, and especially during a pandemic when sometimes those support systems dwindle, because if you are a first responder and you're being exposed potentially to, you know, COVID-19, you probably are not interacting with a lot of people, you know, in your family or in your support system. So this is very helpful for them to be able to determine who is in my support system and how might I be able to react and act within that system. Down at the bottom is a website that gives you just different examples of eco maps, and I'm going to show you one on the next slide. So this is an example of an eco map. This is what one would potentially look like. You can allow the client to choose from various templates, and you would allow the client to decide, where am I on this map? Where am I going to put myself? And then the goal is for them to fill in the other bubbles with people who are significant or people that they feel provide support for them. You know, who is significant in your life? Who provides support for you in your life? Especially during this pandemic, who can you go to? Who can you get support from? And sometimes it might just be their fellow first responders. You know, it might be their fellow nurses. It might be their fellow firemen or police, police colleagues. So, and then again, there's various templates and you can have the client choose. There's flowers, there's a sun, there's one that's a solar system, you know, so the client gets to choose, you know, whichever one they like. And then it's really good to monitor their progress throughout, you know, throughout therapy. So at the beginning, the middle, and the end. Okay, so mandalas are the next one that we use a lot with clients who've experienced some kind of trauma, and it's really beneficial for them. You know, mandala has symbols in religion. It really represents a universal theme. It comes from the Jungian concept. If y'all remember your theories and Jung, that's where it comes from. And it's really a chart or a geometric pattern that kind of represents symbolically a microsystem of our universe. So that's kind of what it is, just so y'all have a conceptual map of kind of what the mandala, you know, is and how we use it. And these are some examples. There is a site, it's called freemandalas.com. And if you go on that site, you can pick any pattern you want. What I usually do with clients is I will go on the site, and when I see clients in person, print a couple of, you know, templates like these and have them choose what they think represents kind of their journey or their life. There is also one that you can do virtually, and I believe it's virtual mandala. And if you go to that site, there's different patterns that the client can choose virtually, and then they have different colors, you know, down at the bottom, and you just click on one and click where you want to color it in the screen, and it just allows you to do the whole thing virtually. So if you are providing health services to first responders or clients who've experienced trauma, you can do this activity, you know, via telehealth. But what this represents, what you would want to say to the client is, I would like for you to choose a pattern that kind of represents your worldview or your life. Or if you're working with someone who's had a traumatic event, I might say I would like you to choose a pattern that might be representative of your trauma, or might be representative of the pandemic, maybe if you're working with a first responder. And then what I ask them to do is to take a variety of colors and take some time and to color in the mandala. And when they're finished, they get to talk about it. They get to tell their story. You know, why did I choose this color? Why did I color maybe the outside first and work inward? You know, what do all these circles represent, you know, for me? Why did I pick one that had a lot of circles on it? Or why did I pick one that had a lot of squares or had a lot of, looks like flower petals? And they're really allowed to tell their story, you know, in terms of the mandala and what they created. And again, this is a good one to do, you know, maybe toward the middle of the therapeutic process and toward the end, to see if the pattern that they choose changes, and if the way that they conceptualize their life and where they are now at the end of therapy, you know, has changed. Okay. All right, sand tray. Sand tray is a superior intervention to use with anyone who has experienced a traumatic event. It's also great to use with adolescents, even, you know, pre-adolescents. It's just an excellent intervention. Couples, families, you can just use it with any population. So the sand tray really gives folks a chance to express emotions that they can't verbalize. And sometimes when clients have experienced a traumatic event, they can't put that into words. They don't know how to talk about it. They don't know how to assign words to it. So the sand tray gives them the opportunity in the sand to be able to express some of those things that they can't say and they can't tell you. It's really a quality sensory experience. So it really provides the client with an opportunity to kind of tap into those other senses that we normally don't tap into when we just do the traditional talk therapy. It really allows for that therapeutic distance. Sometimes clients who've experienced trauma could find it difficult to be therapeutically connected with you as the clinician. So the sand tray really allows them time to have their own space and their own tray and to just be in that space, and where the therapist can kind of take a step back and allow them to just create what they need to create and allow them as much time as they need to do that. It's very effective for traumatized clients because, like I said, they're able to choose whatever they want to put into the sand. They're able to tell their story. It gives them a sense of power and control. They can disclose as much as they want to in the sand, as much as they're comfortable with. It's totally up to them, and they take control of that. It really helps clients with boundaries and limits. Sometimes clients who have been traumatized come to us and they really don't have very effective boundaries and they really don't know how to set limits. And the sand tray is a good place for them to work on that. There are several miniatures that we use in the sand that signify limits and boundaries, like fences, walls, different things like that. And it allows the client to really put those things in the sand and talk about, where they want to place those limits and boundaries in their life. And then it really allows therapeutic metaphors to emerge. Clients who have experienced a traumatic event, it is always so surprising to them what happens in the sand. They will start with the sand tray and they will pick a few miniatures, and before you know it, they have created this whole story of their trauma or what has happened to them. And it is so powerful. And more often than not, when they look at it, they will verbalize, I didn't realize, that any of this was there, at all. I think also the sand tray is very powerful because one of the things that I will do with clients is I will ask them just to create their world in the sand. I will leave it very open-ended. And they are free to do that however they choose to do. And then I will ask them just to tell me about their world. Tell me about what you've created. I give them the opportunity to take things out of their world if they'd like, to change things, that they've put in their world. But it's totally up to them. It's totally up to them about that world they want to create and what they would like to share, with you in terms of creating that world. Okay. So those are the expressive arts interventions. Like I said, those are only a few, but there's many more, but those are really the top ones that are very effective with first responders and clients who have experienced trauma. So I'm going to turn it over to Dr. Marino, who's going to talk about supervision.
Okay, great. Thank you. I think that the biggest thing that we have to consider when we're doing supervision is to make sure we're really attending to the supervisee's developmental process and not solely focusing on the client. Certainly we want to make sure that there's not being any harm done, but really our focus in the clinical supervision world is to make sure that our supervisee is developing their clinical skills and getting ready to be a clinician. And so we really have to decide whether or not they're struggling with their client who perhaps is a first responder, and what are their barriers in helping them and reaching them. I think something that's really important just to conceptualize generally with first responders is that there's a culture that we have to really consider in these populations. And so certainly there's a lot of research to back up, for example, the culture that exists within a police force or within a firefighter, district, or even per firefighter house. There's this culture oftentimes that will stigmatize, being vulnerable. And that, there's this very masculine sort of way of being that society says that we have to uphold. And we certainly know that in counseling, we try to break down those barriers and create this safe space for them to, like we mentioned earlier, take off that mask and help them feel safe enough in order to access those true real emotions that come out. Because obviously we know no one has a hard shell, and even though they have to maintain that sometimes for whatever reason, well, whether it's again a societal conditioned belief, or whether it's an unconditioned belief, or whether it's something that's taught to them. And I will say, just in personal experiences with my husband being a firefighter for over 17 years now, is that there is certainly a stereotype that they just have to keep going. And so if you can imagine this whole exposure to disease with COVID-19, and for them, we didn't have vaccines, last year. And so they had to still work, and they still had to go on every single call. So when we think about first responders, just with firemen in particular, that means car wrecks, that means house fires, that means overdoses, that means anything that someone would call 911 for, firefighters go as well. And they are the first ones on the scene to assess whether or not they're going to the hospital, they're calling law enforcement, and so on and so forth, or EMTs. And so when these first responders were out there last year with no vaccinations, doing the job every day and worrying about whether or not they were going to be exposed to COVID-19, that created a significant hypervigilance. We talk about being in a state of vigilance, but almost a hypervigilance to be very scared on a daily basis, and then have to come home and then just live their normal lives. And so while families might have been scared, in general, everyone had their fears around contracting the disease, they had to be exposed to this every single day and didn't have any protected, barriers at that point. We think that they might have been privy to having hazmat uniforms and things like that. The reality is they weren't. And so they did have this increased level of fear that created this sense of fear over time, that now we're starting to see those residual effects. We know from trauma events, we usually don't see clients experience them oftentimes for years on end. Why is that? Because they just usually have to pick up and do the next shift and go to the job the next day. And so oftentimes they don't rely upon their fellow cohorts to process these events, because there are ranks within these professions. And so, there is this unfortunate sense of, having to just keep going. And then what our job is as mental health professionals is to help them to access those things and be okay with it, but also not create this sense of having our clients to feel like they need to do those things and they need to access those vulnerable parts of themselves, because that actually might be maladaptive for them. That might not be helpful for them. They might actually need to have that mask on to go to work the next day, and they have to protect themselves. So we have to also be appreciative of these coping skills called masks. And while sometimes they're not effective in all situations, oftentimes they're protective mechanisms for themselves. And so it's really important that we assess those things. Our supervisees, on the other hand, might not understand that process, especially early on in their careers. They might not understand that, it's not always helpful to break down all of those barriers within first responders because of those reasons, because they have to protect themselves, and they do need to go back into their culture and maintain whatever it is to help them keep going. So our job as supervisors is to assess, first of all, where our supervisees are in their developmental process, but also figure out how they're conceptualizing their clients. And, certainly not everybody has a family member or a loved one who's a first responder, but we can know and keep up to date on research, and especially within these particular demographics, to understand the prevalent issues that they face day in and day out in these professions. So if you have a supervisee that it has a client that is a first responder, even if you don't personally have any experience, I definitely encourage and challenge everyone here to do a little bit of their own research above and beyond, and figure out what are the prevalent issues within these demographic populations that require the most support, and where are the challenges, and then how can you learn and help not only yourself to develop and grow, but also help your supervisees, and then of course in turn to help their clients. And so what we do in supervision obviously is recognize when there's some trouble conceptualizing cases, when perhaps there might be issues of countertransference coming up. So I'm going to use Bailey as an example. She was my student in class, but she also had this fabulous idea for her group counseling proposal, which was to provide pretty much expressive art interventions for first responders in a group counseling setting. And so the first thing I had to help her to sort of muddle through and think about is, how close is this to you? And certainly it's real close because that's her mother, right? And so there's obviously going to be a natural layer of countertransference that's just going to come up for her whenever she has a client who's a first responder. Does not mean she can't be effective, doesn't mean she probably can't be the most effective, right? But it's really important to have that self-awareness and to really decide as a supervisor in that role with Bailey, where is she in that process? And is she in a place in her life where she can be neutral and she can be non-judgmental to her clients in this group counseling setting? And what can she think about and conceptualize and be aware of for when things do come up for her? Where are her triggers? Where are her red buttons? What's going to make her sort of go back to some childhood moments? Or, that example of the restaurant being, if her client talked about a similar situation, how can she then, be aware, but then bracket those values of her own and not push those and impose those onto her clients? And so as supervisors, it's really important to see those things that our supervisee might be inadvertently talking about or not saying, or even sometimes overtly saying in supervision. It could just be facial expressions. It could be something that they're straying away from as we're processing the clinical case. And so it's really important for us to decide what is being said, but also sometimes what is not being said, and how can we help them to sort of assess where they are in the process. Because oftentimes when we get stuck with our clients, it's usually something that we're doing within ourselves. This self-processing, this idea of what am I struggling with? Am I straying away from a topic because it's too hard to discuss? Am I leaning too close in because I'm having some maybe boundary issues, or maybe I'm feeling too close to the subject matter? So we have to decide as supervisors where that level of countertransference is coming up for them, and how can we help our supervisees explore what might be happening in that process. Also, oftentimes I think supervisees, especially in the beginning of their careers, have a really difficult time with, but I'm not a parent, but I'm not a man, but I'm not, a member of the LGBT community, but I don't have children, but I don't know what it's like to be a first responder. And so they have these ideas of, I just don't have the expertise. And as you all know, we understand, and what we teach you in these master's programs is that you don't have to experience these things to be able to help our clients. We just have to be present. We have to be open and willing to learn through their lens what it's like for them. So helping our supervisees also to feel confident, to feel competent in what they have learned, and help them to understand that we can walk through someone's shoes without having to have walked it on our own. And I think that's a big piece. So building that relationship, making sure that they are utilizing techniques and interventions. And oftentimes it does come with some of these expressive art things over time that helps to really hone that relationship and builds that trust and sense of security within the counseling context. So then therefore that client or first responder can access some of those difficult and raw emotions through the process of expressive art interventions. And that then also will help the process. But first we have to have that relationship with our supervisees as well. So before we can challenge people to do anything, we have to make sure we have a good working relationship. So really taking the time to build that rapport in the beginning, whether it's supervisee, supervisor, or supervisee and client, it's really important to make sure we have a good solid rapport. And of course, we have to, again, access the supervisee's developmental level. We have to meet them where they are. We can't, expect all first counselors coming out of graduate programs to really feel effective and comfortable and confident doing all of these interventions. We have to make sure that they get there. So we have to meet them where they are and make sure they're comfortable with employing these types of expressive art interventions. I think a lot of people sometimes, think it feels silly to, color with adults, or to play, or to access sensory items such as Play-Doh, for example. So we have to first access, how do you feel with playing? And so I oftentimes will have conversations with my supervisees from the very beginning before they have a client that they want to employ these interventions with. And I really want to access with them how they feel about play. What was it like for you growing up? How were you taught to play? What was playing like in your family? was playing loud, and I'll, have some dialogue and figure out, you'll hear all kinds of things like, well, we were taught to play quietly, or, we weren't taught to play with toys. We had to play outside. And so, accessing really what it was like for our supervisees to learn about play oftentimes has a significant impact on how they view play as an adult, which in turn will then probably affect how you present the idea of utilizing these types of interventions with clients. And so, I often will help them to really explore how they feel about play first. And then I will do some kind of role play. I'll say, because if I'm your client and I'm a first responder, talk to me about how you might suggest a play therapy or expressive art intervention to me. And from that experience, I can usually access, where they are in that process. Does it feel silly to them? Do they feel like it's going to feel a little awkward or uncomfortable? And then we process that. And then we practice it again. And so I get them to really feel comfortable with even suggesting it, because I do think that the way you suggest interventions to clients oftentimes is how they hear that intervention. And then we can sometimes shut it down before we even allow them to really make a decision. So keeping in mind that if there is already a really cultural influence within these first responder arenas of that masculinity and that, macho type of behavior and sort of just going on with it, then it's likely not going to be as easily received as other clients, right? And that's a generalization. It's certainly not for everybody, but I think overall we can conceptualize it that way. So we have to understand that when we're conceptualizing a case, and we have to make sure that we're presenting something to our clients that if we already know might be not well received initially, that we have to make sure we feel okay with it. We have to make sure they're ready for it, because there are windows of opportunities with clients. And then we have to make sure that we're offering these things in a way that feels safe to them, that it's not going to be silly. We're not going to out them. Confidentiality is really restored and maintained to the fullest extent. So all of those things are really important. So before I have my supervisees utilize any of these interventions with clients, I think all of that groundwork needs to be laid first, and then we can get to actually employing things. And that's what we teach our students. A bag of tricks is just a bag of tricks, but it's really not the intervention that matters. It's about how you present it, when the window of opportunity is. And then again, like Dr. Laura said earlier, if your client initially says, no, they're not willing to, access that type of intervention, that tells us something. It tells us either they're not safe yet, they're not ready yet, they feel silly, they're not sure about it, they don't believe in it, they maybe weren't taught to play that way, right? So it tells us something. It's food for thought. We don't push our clients when they're not ready, but also I think it's really important to circle back on that and explore what it is about not wanting to do the intervention, because oftentimes that's where the work is with our clients. So all of those things are important to really consider. And then our supervisees, of course, when we're going through this whole process of getting them ready to work with clients on this level, where are they in receiving feedback? Where are they in the process of wanting to grow and willing to expand their worldviews outside of what they may have been taught in their graduate programs? Some students will go through graduate programs and come to me in supervision and say they never were challenged, to think about their own lives and how they were taught to play. And so it might be the very first time that they're really being encouraged to do some of their own work. And not that we're acting in the counselor client role in supervision, but part of the theory that I espouse in supervision is really Bernard's model, where in the beginning, I am a little bit more like a teacher, and I do espouse some of that counseling sort of context as it relates to clients, and if it's a barrier for what they're doing in their counseling relationships, then I have to address those things as a supervisor, as a gatekeeper of the profession. It's super important that my supervisee is ready and healthy and willing to do the work themselves before they can expect their clients to do so. So, how are they with receiving feedback? And, where are they in that process of corrective feedback? How are they taught to receive and give feedback as a child? What does that mean for them? Do they need to go back and do some of their own work in counseling? Because part of what we do in supervision is a heavy exchange of feedback, not only in the individual supervision settings, but I employ group supervision. And so I encourage a lot of peer-to-peer feedback. And so if I see some resistance or hesitation that comes up, and encouraging them to take a look at themselves, then I have to be a gatekeeper and encourage them and challenge them to go and do some more work so that they can be healthy and ready to work with their clients. And then finally, that collaboration piece that's so important. I think really for all of you who are there or may not be there yet, accessing that supervisor, really looking for somebody out there who maybe can offer you that group supervision piece, because I think it's so valuable when you can be in a setting that you're learning from school counselors and marriage, couple, and family counselors and career counselors and clinical mental health counselors and marriage, couple, and family counselors, and everyone can have their different perspective, their different worldview to come into the whole process of how can we help these first responders? Do they have children in school? How can we, see through that lens? How can we conceptualize their relationship with their partner, and how might that be a factor in whether or not they're ready to employ these interventions through the expressive arts realm? And really understanding that collaboration is so important, and it's definitely effective to be able to see things in a light that oftentimes we don't see, because we just we'll go through our own world and our own conceptualization. But it's really important to be able to access and collaborate. We know in our professions consultation is key. We never want to make these decisions on our own that are difficult, especially when it's relating to suicidal ideation, for example, or depressive symptoms with clients. And we know statistically that first responders have high levels of all of those mental health issues that Delina and Bailey mentioned before. And so oftentimes these are very difficult cases. When you're dealing with, last year, for example, we know that fires still went on. There were people that were burned and taken out of homes. And at the same time, also, having trouble breathing with COVID-19, not just from the smoke, but from the disease. And so these are really difficult things that these clients will experience. And so as a supervisor, it is really incumbent upon that level of gatekeeping to make sure that our supervisee is healthy, because we need to make sure they're in a place to really help that client that are going through significantly traumatic events. So supervision is really important in all respects, and certainly encourage everyone who is listening today that even if you're not pursuing licensure, if perhaps you're going into school counseling, to really consider that. It's certainly a value to have that support when sometimes you may be the only person in a school building who is a mental health professional. And while you don't have to have a license to practice, sometimes that can feel isolating. And even outside of the school setting, if you're a licensed professional and you're out there and you're an LPC and you're doing the work for a while in private practice, again, it can be really isolating oftentimes working with these cases that are really difficult. And so accessing some supports, where it's a networking group or, utilizing some colleagues from grad school to have a consultation group on a regular basis to talk about these cases, even to process for yourself what might be going on for you. And so as I conclude this section right now, just to kind of focus on some sort of interventions that you can do as supervisors and working with your supervisees. You can look back at the sand tray, the mask, the eco mapping, any sort of expressive art intervention to help your supervisee through that process. And with expressive arts is really, really powerful. And so we oftentimes will work with our supervisees to say, what is your barrier in conceptualizing this case? And so we'll give them some paper, some colored pencils, or some paint or whatever we're using through those mediums, and get them to really access what their barriers are. And so Dr. Laura is going to end with some 2 interventions that maybe you all can consider using in your supervision process as well.
Yeah, so and I know we're short on time, so just quickly, I just wanted to give you all just 2 interventions that can be really helpful, when you work with supervisees, especially supervisees who are working with clients who've experienced some trauma, specifically, first responders. So this is the Build a Nest activity. And this is an activity that I think is helpful if you conduct it early in the supervision process, early in the supervisory relationship, because as we talked about, it's really important that the clients that we see, especially those who've experienced trauma, feel safe. Well, it's important that our supervisees feel safe, and they need to feel safe with us. They need to feel safe during that supervisory relationship, in order for them to help and facilitate their client safety, when working with clients. So one of the things we would ask supervisees to do is we would say, you know, we're going to build a nest. We're going to use this activity today, and it's called build a nest. And so you can do it two ways. You can have the supervisee physically go look for some things that they might use to build a nest, you know, things that, you know, might have fallen on the ground, things that they think of, you know, when they're going to build a nest, you know, what would I encompass? What might I, you know, use for my nest? What do I need for my nest? What do I need to feel safe? You know, just make sure that if you do this activity, you know, you have some oversight, you know, in terms of where are they going to build the nest, to make sure that it's, you know, maybe a safe public area. And then, so you're going to ask them to think about or write down what goes into a bird's nest. And they can think about that, or some supervisees may decide, well, I'm going to go out and start gathering materials while I think about it. You need to allow them enough time to collect materials and then to come back and build their nest. And then when the nest is complete, you process the experience and you share your observations. You can do this individually with your supervisees. This is really effective in the group. If you do group supervision, you know, this is an excellent activity to do with the group, because everybody gets to process and everybody gets to provide feedback. You can prompt the supervisees with some questions, you know, tell me about the nest you created. What qualities did you decide to incorporate into your nest? Was it a challenge to determine the items that you wanted to put in your nest? Did you change your mind as you started to build your nest with your selected items? What pleases you about your nest? What works for you about your nest? And is there some aspect you're not quite satisfied with? And what else does your nest need? So those are just a few sample questions, you know, in terms of prompts. You may not need all the prompts, you know, you may just ask, tell us about the nest, and your supervisee may be able to articulate all of that, and you all can have a conversation around that, or you can work through some of the prompts. And then a variation is to ask the supervisee to write a story about their nest and then title it. So if you don't physically want your supervisees to go out and gather things, or if that's not feasible, you know, if you're doing distance supervision, you can ask them to write a story about it, you know, and talk about, you know, they can address those questions like, you know, who lives in your nest? What dangers, you know, does the thing that lives in your nest face? How does it protect itself? You know, is your bird content with who is in the nest? What else does your bird need to flourish? So you can do that as well. You know, you can have them write a story, and then you can talk about it, you know, during the supervision process. And then this is the second one. This is called a handful of guidance. And just very quickly, you know, this is just to reinforce to the supervisee that everybody needs support, kind of when we talked about the eco map earlier on. And this is just an activity to help the supervisee conceptualize goals of supervision and how might they receive support from you as the supervisor. And also how they might work well with clients, you know, who are exposed to some challenges, you know, clients who have challenges like those who experience trauma and first responders. So the things that they need are just a sheet of paper, colored pencils, pens, markers, or crayons to do this one. And then what you're going to ask them to do is you're going to ask them to trace their hand on a sheet of paper. And then once they do that, you're going to have them respond to the prompts. So they'll trace their hand, and then for their index or pointer finger, you'll ask them to share a direction they wish to travel or a goal that they will strive for in supervision. For the middle finger, you will ask them about stressors or frustrations that they might experience during the supervision process, or you can even broaden it and say, you know, or with clients, what stressors or frustrations do you think you might experience with clients? Their ring finger, note how you might show commitment to your clients and to the process of supervision. The pinky finger, talk about how you may stay present and or hope to present yourself doing supervision and with clients. And then the thumb, share what and who helps you hold it together when you are experiencing some issues. And then you just process the experience with them. You know, you ask them, you know, what stood out for you about this activity? What themes do you see? Do you see any common themes that emerged among your fingers? and how can I help you as the supervisor hold it together when you have some challenges you will face even personally or with clients. You'll face challenges with clients. And that's just a great activity, and again, you can do it individually, or it also works very well, in the group if you do group supervision. And then just our references, we've given you all a reference sheet where we got some of the information that we presented today. All right, well, I don't know if anybody has any questions, but we have about 3 minutes. And I think y'all can just unmute and ask questions if you have any.
All right. Well, if there's no questions, we really thank you all for joining us today and being interested in expressive art interventions with first responders. We encourage you to keep doing good work, take care of yourself, and enjoy the rest of the conference.
Yeah, thank you all.